Hey, it's Roberto Miki again, and we've got another great hand question of the week. It's number 21 in our series of questions for medical students, residents, and fellows studying for the boards or in training exam. Well, let's get right to it. A 14-year-old male presents with a small finger contracture present since birth, shown in the images to follow. He has no pain and full function. What is the next step in management? A. Flexor digitorum superficialis tenotomy. B. Observation. C. Release of the proximal interphalangeal joint volar plate. D. Dynamic external fixator placement. Or E. Reconstruction of the central slip. Well, here is the clinical lateral view of the right small finger. Here is the clinical posterior view of the right small finger. And here is a lateral x-ray of the right small finger of this same patient. Here's your chance to pause the video so you can have a chance to answer the question. The clinical photos and x-ray images are consistent with Camptodactyly. Camptodactyly is a congenital variation, and it is classically seen in the small finger, and it is a contracture of the PIP joint. The patient is unable to fully extend the PIP joint but can fully flex the finger. Camptodactyly is typically treated non-operatively with observation. In younger patients or patients with worsening contractures, stretching and splinting is an option. Surgical release and correction are rarely indicated. So the answer to the question is B, observation. Hope you'll learn something, hope you'll enjoyed the video, and we'll see you at the next one. Remember to like and subscribe to help this channel. We'll see you on the next one.